Well, hello again. We had a bit of a technical issue here. It happens, and not in our defense, but it happens also the other morning when I was doing PE with my daughter to this guy that has millions of followers. So it can happen. It can happen to everybody. Yeah. So we are back. First of all, thank you so much. I could not answer all the questions I was receiving. I hope now this is working again. And so there are some that I selected here that perhaps have not been addressed yet. Here it is. I have suspected Raynaud's and waiting for a referral to rheumatology to have diagnosis confirmed. What advice would you give for people in my situation? And there are a few questions on this line, meaning I'm not sure I have scleroderma yet. I'm having symptoms. How should I deal with it? And there are also some of my patients that ask me for that. Now, it depends what are the symptoms that made you suspect scleroderma. If this is Raynaud's and you have no lung issues and you have no immunosuppressant, don't panic. There is probably, you might have it or not, but even people with scleroderma, they're not taking immunosuppressant and they do not have any lung involvement, they shouldn't shield. If you've been referred to rheumatology by your lung doctor because you have a lung disease and they suspect it's coming from scleroderma, that's a different story. And yes, you should shield. And questions are coming back. Great work, though. Oh, there was not a question. Thank you for that. Stuart, good afternoon, Dr. Galdo. I have recently been treated for low lung function and have had I think it's cyclophosphamide, and I'm now back on mycophenolate, and I'm building up my tablet intake to 2 grams. Should I stop taking the tablets if I have the symptoms to enable the immune system to build it up against it? Great question, and thank you for asking. So, you are, of course, in the high risk category because you just stopped cyclophosphamide and you're taking mycophenolate. So, you should shield. You should not stop to take your tablets if you do not have chest infection symptoms, because this is the advice we've been giving to everybody. The tablets we give you are to try and slow down the process that can bring damage to your lungs. Now, these tablets, they become counterproductive if you have the viral infection. If you don't, you better stay on it. If you have any sign, fever, cough, or chest infection, as your consultant has probably told you already, you should stop immunosuppressant. And then in case it's bacteria, you take antibiotics, or hopefully will not be this COVID-19 for you. So, and this is actually an answer to many questions on the same line. These times are not just a reason to stop your current medication. You shouldn't. Your medication just put you in different type of risk, but keep taking them and stop only if you develop symptoms of this viral infection. Chris, sorry, we're back. Yes, we're back, Chris. Sorry, something happened here to my computer, I think, or to the internet. So, but we're back. Now, some more question. I would like to know if people with scleroderma taking immunosuppressed medication are at greater risk of COVID than people with scleroderma who are not taking any medication. So, let's discuss about this risk. The risk of getting the infection is not because of scleroderma or because of the immunosuppressive drugs. Anybody has the same risk of getting infected if they are in contact with somebody that has had it or has been spreading it. The risk we're discussing here is not the risk of having COVID, it's risk of having complications from the infection. As you probably have read, because 70% of the news is about that, most people getting this virus go with very mild symptoms. Some people do not even realize they had it. That risk is not increased or reduced because of scleroderma. And there are actually some research work we're doing to see whether people that have a hyperactive immune system because, for instance, they had an immune disease like scleroderma or like rheumatoid or like lupus, they have any higher or lower risk of having complications from COVID. We still do not have data to say whether this is the case or not, but for now, the comforting news is that we don't see more patients in the wards with COVID that have rheumatoid than what we expect if there was not just random. So the risk we're discussing here is not the risk of any infection, but to have severe pneumonia because of the infection. Okay. Oh, you are my consultant. Oh, yes. Oh, now I understand you are. Yes, Stuart, Thomas. Yes, I am. Okay. So I hope you received the letter. If you didn't, it's on its way. But you take this as advice. So you stay on mycophenolate, and you are not have to stop it unless you develop symptoms. If you do, ring the helpline. You can also contact the Leeds Scleroderma Program website, and I reply right back to you. Now, doctor, when you have a minute, Chris, what are the triggers to contact the NHS as the 999? So, everybody should contact 111 first if they develop symptoms of COVID-19, and there they're triaged there and say, okay, you stay at home and stay safe and self-isolate, or contact 999. If you are identified as a high-risk individual, because you already know that you should shield, you can skip 111 and contact 999 directly, and you say, was advised to shield because I have a poor lung function, and now I am coughing and I have a fever, and they will tell you what to do. I hope this answers the question. So Paula, I'm waiting for pulmonary hypertension to be officially diagnosed in Bath. What should I do? Okay, that is a tricky one. So if you're waiting, I guess you're being referred to a right heart catheterization because there was the risk at your heart scan. And it depends on your lung function. If this was just a precaution because your echo didn't look exactly as it should and your lung function is preserved, meaning that your doctor told you that your numbers are still within normal ranges, then you should just social distance. If your lung function is reduced, and reduced lung function is one of the reasons by which you have been in this diagnostic of pulmonary hypertension, don't wait. It's better safe than sorry, and shield. Paula, oh heck, my question disappeared. Sorry, Dr. Galdo. Okay, oh sorry, maybe it didn't disappear and I just didn't catch up with it. And I still don't know, and you need to forgive me because I'm learning through this. Questions go up the feed and then I cannot get them back. So before there is no IDOC is correct that we still have to attend for blood monitoring. I have to use taxis and I have to go not the best way to get the hospital. So this is a question of blood monitoring. I discussed this earlier. Talk with your doctor. We've been relaxing some rules for people here that have been doing blood monitoring for years and never had any issue. And so we're trying to spread it out a bit. So for 1 month, we go to 6 weeks, or to 2 months. From 3 months, we go to 4.5. Talk with your doctor. Yes, it is sensible. If you don't have any reason, because your bloods have never been borderline, perhaps you can relax it a bit. So the question that disappeared from Paula, I'm a physio and currently working from home. As my occupational health has told me too, in the past 9 months, I had a full course of steroids for myositis. I'm now on 2.5 and on Methotrexate. Can I go back to working on the wards, continue to stay on work? All my other test results are okay. So you are on Methotrexate and one other drug. If you see the advice, you are at high risk and you should apply strict social distancing. I admire that you want to go back to work. And physio is so important for our patients. But the steroids, and we're taking now methotrexate, and the steroid, even if it's just a small dose, I would wait a bit longer. If you just had a high course of steroids, it means that you're barely controlling your condition. Now make sure that your condition is stable, it doesn't flare, and if you are only on methotrexate and you don't have any other risk factor, then yes, you can go back to work. Something appeared here. Then Ellie went to high school Stafford, okay? Very good, that is great, thank you. And I don't know how you managed to make up your high school, but well done. You know more than me on this. Question from Helen. My question is, this is a question that came from somebody directly to SRUK. My question is, if I do show a symptom and dial 999 following his advice and turns out I haven't got it, will I put in COVID-19 ward and or be more at risk in hospital of contracting it? So your question is, if you show symptom and for 999 they bring you to the hospital, what happens? So there is so you're concerned that just by going and being tested will put you at risk of being infected. The risk is not zero, but hospitals are doing their best to have what we call a patient flow, where people that are at risk, like you would if you contact 999, follow a path that is different from people that already know they have it, or people that already know they don't have it. So each hospital has these routes, and that's why patients have been told not to show up in A&E, but to follow the routes. So if you are bad enough that you have to call 999, don't worry about that and follow what they tell you to do. Ellie, I wonder if you can help me. I have only had one dose of methotrexate since the beginning of December, as I have been on antibiotics. They are due to finish tomorrow. Should I restart the methotrexate? That is a very good question. And the answer to this, it depends why you're taking methotrexate. If you're taking methotrexate, most probably it's for a connective tissue disease or for arthritis, and most probably your lungs are okay. So yes, go back on methotrexate, because that is important to control your disease. And the last thing you want in these times is a flare of your condition because you're not taking methotrexate. Methotrexate, yes, puts you at a slightly higher risk. Please follow the flowchart to see where you have any additional risk factor. But if you suspend the methotrexate just because of an infection, and now thankfully that's cleared, yes, go back on it. Deborah, hi. So I'm right in thinking that if you have scleroderma, you should receive a letter to inform you on the level of isolation to follow. That is, in the ideal world, yes. The trusts, now all the hospitals are facing a double challenge. The first is to fight the people with COVID-19. It is new for everybody. The second is there is half staff, because half is either isolating or it's home taking care of the kids. And the third is try to prevent new infection, sending letters to everybody. We're taking all the resources that we have available, letters, diagnosis, but guess what? Would not be perfect. So if you have a chance to contact directly your doctor to see whether you should shield or not, if you didn't receive the letter yet, do it. In general, if it's just scleroderma, and just meaning, I don't want to diminish any of the symptoms of scleroderma, but if you do not have lung involvement, you do not take immunosuppressant, and like I discussed before, you might have bad GI symptoms and bad Raynaud, that doesn't put you at increased risk of complication from this infection. Carol, you are my consultant, smiley face. Yes, hi Carol. Thank you for taking the time to do this, very helpful. I received text yesterday saying I'm extremely vulnerable. Thank goodness the texts are going out. We've been working so much for that. I don't take any medication on the list, but I have Raynaud, scleroderma, and Sjögren. My question is, can I go in the garden? Yes, you can go in the garden. It's your own garden, I presume. Go in the garden, take some fresh air. Unfortunately, there is another toll of this condition of people isolating, and is the mental health and well-being. So if you're one of the lucky ones that have a garden, make it look at its best. This is the time of your life. You have no excuse for your garden not to be beautiful. So go ahead and work on your garden. Irina, we miss you, doctor. Bless you, Irina. I miss to see all of my patients too. I can't wait for these times to go over. That's made everything so vulnerable, or our plans, or our research prevention plans. I miss you too, but we will meet again. Question written to SRUK from Deborah. Hi. So am I right in thinking that you have scleroderma? You should receive a letter to inform you of this. I already replied. Hi, doctor. I received a letter to shield for 12 weeks, but my husband was at a heart bypass, hasn't got one, and he's a bus driver going to work daily. Is he putting me at risk? Thanks. Yes, if you're shielding people in your household are not, they are putting you at increased risk. And this is a very delicate situation. Your husband can discuss with his employer whether he could self-isolate for you, and I hope he can. If he can't, because he's designated a key driver, they might suggest that you isolate from each other, which is the last thing we want. Or that, as somebody suggested, that he applies all precautions when he comes back before seeing you to get rid of any possible sign of infection or any method of contagion. This is not easy, so the best thing would be if we could call it off. If he can't, I admire what he's doing. People are still using public transport, and try to be as safe as you can. Claire, when the lockdown starts to be lifted and shielding period is finished, am I wondering what will happen then with any second waves, continued infection until vaccines are available when you are more vulnerable? I know you don't have a crystal ball. Yeah, I don't have a crystal ball, and I can't wait for that moment. And guess what? This will happen. By the time we learn how to handle this shielding, they will start to release it a bit. And by the time we learn the answers, they will change the questions. We will face those when they get here. If we get there, first of all, is a good news, and we will do our best. I will try to contact all our patients, and all the hospital will try, and this will be a phased lifting, meaning the same triaging of people being at low, medium, and high risk will be done for lifting. So people at low risk, or people that show that they are immune, they'll be released first, and people that are shielding, they'll be released last. But let's hope to get there and have that problem as soon as we can. Jackie Calver. I've been taking mycophenolate for 6 months due to lung involvement. Blood tests so far have been fine. So mycophenolate for 6 months for lung and blood tests are fine. Should I postpone the blood test while shielding? Thank you. Okay, so that is a decision of your consultant. Am I your consultant? I'm a lot better with faces than names, probably not. You can defer it for a few weeks. We have our nurses in our hospital that ask me the questions of how long they can defer it. If you're taking mycophenolate because of lung, of course, you know that you should shield. And if your bloods have been fine, skipping a few weeks will not be the end of the world. So please don't take this decision by yourself. Discuss with the nurse and with your doctor. It's still your consultant decision, and I decide on a case-to-case basis. Some people have never shown any sign and they have low risk of the side effects. What are the side effects we monitor for? If your blood count gets low, it's the most important one for mycophenolate. The liver toxicity is very little, so we don't want your blood count to get low. If that never happened, chances are it's not going to happen now, and defer it just a few weeks will not be an issue. If your doctor thinks that you might be at risk of having that, you might reduce the dose of mycophenolate a bit, but this is your consultant decision. Chris, hi. I have systemic sclerosis, but I also have asthma. Could you confirm if I'm in the high risk group and not the shielding group? Okay. Asthma. It depends how severe is your asthma, and it depends whether your systemic sclerosis is affecting your lungs. And it depends whether for your systemic sclerosis you're taking immunosuppressive drugs. So as soon as this podcast will finish, please go back on that video that SRUK has posted that we have done for our patients and the flowchart, and see how many of the risk factor. Shielding is for people that have reduced lung function and they are on immunosuppressive and they have other risk factor. You'll be able to see that. Oh, Claire is very active. Thank you for everything. Your words are comforting and reassuring as always. You're very kind. So now we have a few more minutes left. Dawn Wilkins. Hi, I've got scleroderma and take nifedipine and losartan, and these some of the medicine listed. No, nifedipine and losartan, it means that luckily you have a form of scleroderma that is affecting probably you with Raynaud's. I'm not sure if you're taking losartan because of your high blood pressure or because of your Raynaud's, but if you're not taking immunosuppressant and your lung function is fine, then you should not worry about shielding. Just apply the social distancing and stay safe. Okay, last couple of questions. I'm not sure what to do. I'm waiting for my diagnosis of scleroderma. I think I discussed this earlier. Yes, it depends on why you're waiting for your diagnosis of scleroderma. It's because of your lungs. Just stay safe and shield. If it's because of your Raynaud's and you're not taking immunosuppressants, just do social distancing. Okay, well, so apologizing for this more technical issue. Thank you very much to everybody for joining in and asking questions. I hope this has been helpful. Thank you for collaborating, everybody. Thanks to all the patients in Leeds. Thank you to SRUK for organizing this. I'm trying my best to answer the question directly from SRUK directory on the scleroderma program website of Leeds. And I'm not sure if we're going to repeat this, but for now, thank you and bye.